Good evening, bonsoir. As Chief of Staff and Vice President of Medical and Academic Affairs, it's my pleasure to report on the activities of the medical staff at Santé-Nord this past year. L'année 2014 s'est encore une fois avérée fructueuse sur le plan du recrutement des médecins au Grand Sudbury. Chaque année, l'Horizon Santé-Nord, la Ville du Grand Sudbury, l'École de médecine du Nord de l'Ontario et la Chambre de commerce unissent leurs efforts afin d'attirer des médecins. To date this year, 16 physicians have committed to join in the community, including 4 family doctors, 11 specialists, and 1 emergency medicine physician. Our new specialists bring skills in the fields of cardiology, obstetrics, gynecology, oncology, anesthesia, pathology. The 4 family physicians will add to the community's primary care strength. As we bring children's care into the spotlight, I'm pleased to report we've added another pediatrician to our roster at NeoKids. We improved treatment times in the emergency department even though we treated over 4,000 more patients this past year. De nouvelles interventions chirurgicales sont maintenant pratiquées à l'Horizon Santé-Nord. In addition to improvements in frontline care, HSN's physicians and clinical leaders also put a great deal of emphasis on training and skills development this past year. We did this because we believe strongly learning is absolutely essential to constant improvement. Healthcare, and make no doubt healthcare is making a dramatic transformation. Physicians want and need to be drivers, not merely passengers in that change. Ils y parviendront en adoptant et en transmettant de nouvelles idées et des pratiques exemplaires. A number of our physicians took part in the Council of Academic Hospitals Ontario's Physician Quality Improvement Initiative. This initiative provides doctors with individualized, valid, and meaningful feedback on how to improve their daily practice of healthcare. HSN also hosted the 2nd annual Northeastern Ontario Hospital Physicians Leadership Conference. A little concert would have been nice, actually. And we launched a new lecture series to hear from expert speakers and share information and best practices. In terms of training, our simulation lab enjoyed its busiest year to date. Approximately 2,000 clinicians and learners logged over 11,000 hours of training time this past year. The simulation is expanding its breadth of educational activities, starting in situ simulation programs and collaborating with several academic institutions and clinical programs. It was another banner year for the number and quality of medical learners at HSN. In 2014, over 330 medical learners and 1,500 learners of other healthcare disciplines received enriched learning experiences at our facilities. These learners provided care while they learn, and giving them opportunity to spend time with here greatly increases our ability to recruit and retain skilled healthcare workers. As we look to the year ahead, we must absolutely acknowledge the challenges we are facing. We have one of Ontario's busiest emergency departments. We continue to deal with alternate level of care patients at HSN. This affects our ability to flow patients through the hospital and the entire healthcare system. It leads to longer than necessary wait times and, in some cases, unfortunately, surgical cancellations. Il faut trouver des solutions à ces problèmes chroniques. Il y a donc encore bien du travail à faire. The process of continuous improvement never ends because our challenges will most certainly never end. Les patients comptent sur notre volonté et notre capacité à transformer les soins de santé afin qu'ils fonctionnent pour eux comme cela le devrait. I am quite confident our team of physicians, residents, learners, and of all varieties, nurses, allied health professionals, and support staff have the expertise and the resolve to meet this task. Horizon Santé-Nord est un hôpital dont n'importe quelle collectivité du pays peut être fière. I'm proud to call it a place where I practice medicine. I now have the distinct pleasure of introducing a second guest speaker tonight. I'm proud to say he's one of my colleagues and peers here at HSN. I consider him amongst my very best friends, and I think as a pediatrician, he likes me because I have 8 kids. Dr. Sean Murray is a pediatrician and the medical director of HSN's Family and Child Program. Dr. Murray has been the most passionate pediatrician and advocate for children's healthcare in Northeastern Ontario. He's also been a driving force from the time he came to Sudbury in the creation and development of NeoKids. NeoKids is our Center of Excellence for Pediatric Services at HSN. As we continue tonight's theme of children's healthcare, please welcome Dr. Sean Murray.